All right, our diagrams for this unit are actually starting off with a bit of an animation. And so, hang on here, let me pause you and rewind you. Moves a little bit fast here, so I'm going to slow it down, and hopefully the volume is not on so you can actually hear me. Okay, so up in here is the larynx, and that's actually where our vocal cords are. And you can see the trachea comes down and it splits into the left and the right. And I really like this animation because it definitely shows how much wider the right is than the left. And you can see how the left takes that harder turn than the right. And so if something is coming down here from the top, it is more likely to follow this path than to hang that path over to the left. Doesn't mean it can't happen, but it's more likely to go right than left. And then the minute the bronchi enter each of the lungs, then it starts splitting into those what they're calling secondary and then tertiary bronchi. Basically, those are just the smaller branches that we discussed. Now, if I can forward this slowly here. There we go. I like this angle because it actually shows you here the fissure in the lung. So we have one lobe in the left lung, two lobes in the left lungs. And then as this continues to spin around, you can see that on the right side we have this upper lobe, this intermediate lobe, and then the lower lobe to make three lobes on the right. Okay, and then it continues on. Okay, and then it puts it in color. This little indent here, you can see it a lot better in this color version, is the hilus. And the indentation actually continues down to where those bronchi actually enter the lungs. And then underneath here, this brown part is the diaphragm. We'll be talking about that at another time. As it continues to go around, again, you can see the lobes on the left, the inferior and the superior. And then, the superior and inferior on the right. I think they label it again, yes. The superior, middle, and inferior on the right. Okay. So, and then you can see how this actually works within the human itself. Inside of the rib cage, okay, as you turn. Okay. So the diaphragm is actually up underneath the rib cage, and the lungs take up quite a bit of the room, but not quite all of the room underneath your rib cage. Okay, so that kind of puts it all together for us. Get off of that. All right, so on your diagram itself, we actually have two of them that we're going to be doing. We're going to first look at this one, which is kind of the larger view of the entire system. So let me get my pen going here. All right, it's being slow. Okay, so the first part is we're going to start kind of up at the top around the head, and we actually can see a couple of the sinuses. The paranasal sinuses. This is the frontal sinus. And this one here is the sphenoidal sinus. That was the one that it's kind of hard to describe in words. We say the base of the skull. You can kind of see this is kind of the bottom of the skull. So that's why we get that terminology. Okay. This bracket here on the inside is referring to the nasal cavity. And it is showing the folds in the nasal cavity that actually help to increase the surface area for filtering. These four holes that are at the back there are for the different paranasal sinuses to drain their mucus. And that's why you can see where it's located versus the throat. That's why when you have kind of that mucusy feeling in your nose, it runs down the back of your throat. This area here to about there, okay, that is all pharynx. And then this area here is your larynx. This is your trachea. And then your trachea comes down and it splits here into the bronchi, or bronchus is the singular. And then the smaller branches are the bronchioles. Now, this pull-out section here at the side are those grape-like sacs, and you can kind of see here they're kind of circular, and so they do look like bunches of grapes. These are here the alveoli. And these are what expand with the air as it comes in. And you can see over the top we have these blood vessels, and this is the capillary network. This is where the gas exchange takes place, and the only place where gas exchange takes place in the body. Now, when we are born, these alveoli are actually smashed together flat, so the membranes are actually touching. And there is a lubricant, so to speak, that actually helps to separate them. But that's why your first cry when you are born is so important, because it does take some forcefulness for that air to come in and actually pop open those alveoli. This is one of the things that when babies die at or very near childbirth, that they actually look at the autopsy to try to determine exactly what caused death. One of the things that they can look at is, did the baby actually breathe or not? Once we open those up, they never completely close flat again. So that is one thing that they can look at. Was it something before the baby was born or something right after the baby was born? Because sometimes it is very difficult for them to determine. Now, with the other diagram that is on the back, we are going to take a closer look at the kind of the upper part of the respiratory system and break this down a little bit more. Again, you can see up here we have that frontal sinus. And I also want to pay attention here. This front part here, this bony part, remember, is your hard palate. That's the roof of your mouth that you can actually feel with your tongue. Oops. Okay, yep. Up in here, this is your nasal cavity. And then you can see it up on mine. This section here of your palate, that's actually soft tissue, so that is what we call your soft palate. But you can see they run one right into another, so they're really continuous as far as you are concerned. All right, now on this diagram, because we have a little bit more room, we're actually going to break down the different sections of the pharynx. So from about here to here is your nasopharynx. So this area is the first part of your pharynx, and it carries only air. You can see here, I would look back and I would see this section here, and that would carry both air and food, so that is your oropharynx. And then this bottom section here, down to about there, is your laryngopharynx. And then below that, especially here, starting at that slit-like, which is your glottis, you would have below there your larynx, and then down here would be your trachea. You can see the other tube that runs behind the trachea here, right up against the spinal column, and that is your esophagus. So you have your vertebral column here, your esophagus, and then your trachea kind of coming forward. Okay? So you've got your glottis, and then this blue part here, this is that flap that we talked about that actually closes off the trachea, the epiglottis. And if you remember, epi means above, so literally this is above the glottis, which is right here. All right. In the rest of and this actually covers the majority of what we look at in terms of the respiratory system, the path that this air takes. The other things that we are going to look at is exactly how inhalation and exhalation take place. So we will be talking about the diaphragm. We will also be discussing gas exchange.